Filarial lymphedema is a big medical problem affecting a lot of people in our country. What happens is that the leg gets swollen up and it gets infected and it becomes quite disabling condition for the patient. This is common in India, but it's also common in Africa. And there are a lot of people who are suffering with this problem, and because there is no proper medical attention being given, these people suffer, even though if treated properly, they can be brought back to life.
Dora is a teacher in Tanzania. She had been suffering from lymphatic filariasis, also known as elephantiasis, for more than 5 years. She was brought to Amrita Institute of Medical Sciences to treat her right leg, which was very badly affected by the disease.
My name is Dora. I come from Tanzania. I live with this elephantiasis for 5 years. When I am in Tanzania, I go to the hospital like Muimbili. I take injection, antibiotics, but no relief.
I met Dora in a medical camp when I went to Tanzania for a charitable medical mission. When I saw her, her condition was quite pathetic because she had a huge edema of the leg, right leg. The leg was getting infected frequently. She was finding it extremely difficult to go for her work every day in the college and stand for long hours, as well as her social life was getting ruined. In Amrita, we have a good team that has been formed to manage lymphedema under the leadership of a visiting surgeon, Dr. Manogaran, who is the world-renowned expert in managing lymphedema cases.
I am really glad to serve this most unfortunate people. Most of the time they will be the breadwinner and they have to go on bed for 10 days in a month, so they cannot go for work, they cannot earn, so it is very difficult.
The team consists of surgeons like Dr. Manogaran and assisted by myself and Dr. Mohit Sharma, all the team. And what we planned was to admit her and subject her to a treatment called decongestive therapy.
As part of the decongestive therapy, Dora underwent manual lymphatic drainage. It is a type of massage to encourage natural drainage of the lymph fluid buildup away from her leg and back to the circulatory system. Massaging is done not only on her affected leg, but also on other parts of the body to accelerate lymph drainage. The massage followed by regular bandaging was done for 2 weeks.
Once this massaging is done, you will see a remarkable change in the size of the leg. The size of the leg becomes smaller. More than that, the hard skin becomes very soft, and you can feel that softness after about 2 weeks of time. And this is the time when you operate.
Now we have completed the initial phase of doing the manual lymph drainage, and tomorrow we are going to do the surgical technique.
It is not like the olden surgery, like where you remove it and put a skin graft, or those things are not to be done. What we do is to open up the leg, thin the area which is soft now, and then put it back, reducing the entire size of the leg. After the surgery, Dora was kept in the ICU for a day just for recovery. The leg was kept raised and she had to have antibiotics for a few days, and then the stitches had to be removed in a week's time. Once the stitches are removed, she had to wear a pressure garment. This pressure garment is special. It is measured for her leg and is prepared for her. It gives uniform pressure all over the leg. And this pressure garment has been given to her. She can wear it when she goes back to Tanzania. There, when she goes back, she has been advised lot of things to do. One would be to keep her legs raised when she lies down, take care of the leg so that infection doesn't occur. If infection occurs, she will have to take some antibiotics and apply ointments. More than that, she has to wear the pressure garment which she has given for quite a long time. She has been suggested that may need further one more reduction of the swelling by surgical reduction some stage after a year if it is needed.
Now I'm happy because my leg is become small. I'm working, I'm doing things, I'm enjoying.
When we organized the lymphedema management service in Amrita, we knew that it is going to be a difficult task because it involved participation from a lot of people, including the technicians, including the anesthetists, including the surgeons and the physiotherapy, all the people. For the team, entire team which was taking care of Dora, it was a great sight when she left, leaving us with a face full of smiles. I think it was worth the effort. When you see people like this, like Dora, who go back with great satisfaction and great delight that they can face the world in a much better way than when they started the treatment. At this moment, I would like to mention one more thing which happened to be the turning point in the life of Dora. The fact that I could be there to see her in Tanzania was because of the great work that is being done by the Sanitas Medical Center and especially Mr. Murthy, who heads the Sanitas. His aim has been to bring in quality health care to the people of Tanzania. Many of the things can be tackled with the help of people like me coming to Sanitas, but some of them will need care which is not possible there. So for which we could team up with Amrita and bring over Dora to Amrita and get a quality medical care given to her. So it is possible in future also for a lot of these patients or similar conditions or other conditions where treatment is not possible in Tanzania, we could team up with Amrita and get them treated.